My name is Dr. Rose, and I'll be conducting your eye exam today. It's nice to meet you. So, I have your chart right here. Everything seems to be in order. It's been a while since your last eye exam. Okay, let me just mark that down right here. Okay, yes, of course. No need to worry. Generally you get eye exams when you're a young child, and it's good every now and then to check in. But unless you're having some major problem, it's not like going to the dentist where you should be coming, once a year or every 6 months, give or take. Yeah, so don't worry about that. So this is just a routine checkup, correct? Okay, great. All right. So because it has been a while, I have all of your vitals here, but we are going to want to just update some of your information, okay? Okay, great. So I'm just going to ask you a couple questions, and I'm just going to type it up over here on my computer, okay? Okay, great. So can I have your updated address, please? Okay, great. Okay, yes. And can you please tell me your contact information, a phone and email address? Okay. 7 4s, okay, 742. Okay, yes. And your mailing address, okay. Gmail.com? Sure. Okay. Alrighty. Great. So, let's see. Your birth date obviously is the same. If you can just answer a couple of questions. Yes, thank you. Do you smoke cigarettes or cigars? Okay. Socially? Okay. And how about consumption of alcohol? Would you say once a week, every day, about once a week? 2 or more alcoholic beverages? Okay, great. Do you have headaches frequently, once in a while, or never? Once in a while? Okay. And on a scale from 1 to 10, how intense are these headaches when you get them? Okay. Great, yeah. Yeah, I can add that to your information. That's no problem. Okay. Do you have high blood pressure in your family or a history of heart disease? Okay. Do you have any known allergies to medicine? Penicillin? Okay. Yeah, that's a popular one. Popular allergy. Okay. Is there anything else you want to add? Any symptoms you've been having? No? Okay. Okay. Yeah, just needed a little bit of information. We're all set with that. Let me just put your file away. Okay, great. So the first thing I'm going to do is just examine your actual physical eye. I'm just going to get close and personal, and I'm just going to feel around the tissue of the eye right here and here, just to get a feeling of how your bones are situated, your nerves and your reactions, things like that, okay? Okay. So, of course, we're very hygienic here, so I'm just going to put on these gloves. Just be a moment. Yes, these are a tricky pair, so please excuse me while I struggle. These are the ones without powder inside, so they can get a little tricky. Yes. Okay. Just gotta get the other one on now. Okay. Got our gloves on, so I'm just gonna get close now. Okay, great. So yeah, feel free to close your eyes if you like. You can also keep them open if that's more comfortable for you. Okay. Great. Okay. Now does that hurt when I press over here? No? Okay. How about when I press over here? Does that hurt at all? Okay. Any pain or pressure? Okay. And how about when I press right over here? Nothing? Okay, good. Just going to continue feeling around your brow line, under your eye, and let me know at any point if there's any pain or uncomfortable pressure, okay? Okay. Just gonna do a little bit over here. Okay. You feel a little discomfort? Okay. That's a little bit close to your sinuses, so that might be more of an ENT issue, but I'll make sure to write that down on your chart. Okay. Okay, great. So everything seems okay. You had a little bit of pressure right in here, but that's, like I said, I think that's more of a sinus issue. If it's, could just be some allergies, but if it's something that bothers you or leads to headaches, let me know and I can write you a referral to see our extended wing for EMT, okay? Sure. Great. So I'm just going to take these off now. These, I guess, do have some powder in them. Okay, yeah. Look at that. Roll down my sleeves. Okay, very good. So the next step in our exam, I'm just going to show you some letters, and I just want you to repeat them back to me. They will obviously start from higher or larger to smaller. If you really cannot see, you cannot read any of the smaller letters, just feel free to say pass or read what you can. This isn't like a test where you should feel nervous, okay? Please don't feel that you have to lie about what you see or don't see, okay? Just be honest. Just because you can't read a smaller writing doesn't mean there's a problem or that you need glasses. So just feel free to feel very relaxed, okay? Great. Okay, so we have our chart. I'm just going to ask you to back up a little bit. I'm going to move back as well. Okay, great. So, can you see that? Okay. Yep, so just focus in right here and read the letters. Okay, great. Okay, good. Okay. Go right ahead. Perfect. Okay. Great. Now, if you can just cover your left eye, you can just mirror me directly. This is my right eye, but you cover your left eye, okay? Okay. Let's do the next row. Okay. Yes, good. Okay, perfect. For this next row, I'm going to want you to cover your right eye. This is my left, but mirror me directly, so your right eye, okay? Okay. Right, go right ahead. Is it a little blurry? Okay. That's better? Great. That's okay, you can skip that one. Okay, very good. Now you can remove your hands from both your eyes. Just using both eyes, look directly here. What's the last row, okay? It's blurry? Okay, that's fine. Just do the best you can, okay? Go ahead. That's okay. Alright. You can skip that one. Okay. No problem. I'm just going to take a couple notes. Please don't be nervous. Okay, great. Alright, very good. So far you're doing fine. So we're now going to move to our light exam, okay? We're going to do a series here in this exam room. Then we're going to move to our darker exam room, okay? Great. So all that I need you to do is just follow the light, okay? I'm going to shine a light right into your eyes. I just want you to follow it, whether left to right, up and down, and I'm just going to mark how your eyes react and how your pupils react, okay? Great. So if at any point your head starts to hurt, you have a strong headache, or you feel something's not right, please let me know so we can end the exam, okay? Okay, great. So, okay, just look right into the light. Okay, yep, just follow the light. Okay, very good. Very good. Okay, yeah, just feel free to follow it with both eyes, okay? Great. Good, good, good. Are you comfortable? Okay, wonderful. You're doing great. Okay. Yep, just as you're doing it is totally fine, okay? Very good. Very good, okay. Just follow the light. Wonderful. Okay. Okay. We're going to try this again. Please cover your left eye, okay? Your left eye, so that side, yeah. Okay, thank you. Mm-hmm. Just like before. Great. Very good. Mm-hmm. Just like that. Please don't strain your eyes, just very gently follow the light wherever it goes. Okay. Good. Okay. Now please cover your other eye, okay? With your hand. Just like that. Perfect. Okay. Very good. Are you still comfortable? Okay. Perfect. It's very important you inform me the moment you feel uncomfortable, okay? But for now, I just want you to follow the light with your eyes. Very good. Okay. Okay, great. Okay, now you can remove your hand from your eyes. Take a moment, let your eyes adjust, okay? We're going to move into the dark exam room, okay? So just please follow me. I'm going to have you follow the light with your eyes again, okay? Just like before. Perfect. Great. You're doing a really good job. No need to be worried. Just follow the light, okay? Mm-hmm. And as before, anytime you feel discomfort, just let me know, okay? Great. Perfect. Okay. It's very good. Now, if you can please cover your left eye with your hand, and once again, follow the light. What was that? Okay. You have a little bit of discomfort. Can you continue? Okay, great. Yes, I'll make a note of that. That's very important to know. But if you feel you can continue, we're almost done. So let's finish the exam. Your pupils seem to be reacting well. Okay. Yes, good. Okay. Can you please cover your other eye with your hand, okay? This is the last part, I promise. Very good. Great. You're doing very well. Yes. Okay. You feel that discomfort again? The same spot? Can you point to where that spot is? Okay, great, thank you. I'll make a note of that for later. Okay. Yes, you're doing very good. Okay, very good. Wonderful. Very well. Okay. Please take a moment, let your eyes adjust, and let's meet back in the first exam room, okay? Alright, well, thank you so much for your patience with that. I do know that the light part of the exam can be a little uncomfortable, sometimes unpleasant for some of our patients, so I appreciate you being very brave and dealing with it. Now I have written down here, generally everything went really well. Your eyesight is great. You do seem to have a little bit of trouble with this eye, with your right eye, which is your eye right here. I noticed when we were doing the light exam, your pupil didn't dilate quite as much as the other one. And when we were reading the letters off the chart, there seemed to be some blurred vision there. I don't think you'll need glasses, at least not yet. But I do recommend you check back in about a year. Give it a year, and let's reevaluate. If that eye seems to be doing worse, maybe we can look into some kind of glasses or contact lens for you. If it's the same, I don't think we have to worry. It might even be better. Sometimes your eyes just get tired if you're stressing them a lot. If you just have a lot of stress in general, a lot of tension that builds up behind the eyes, it can sort of strain your eye and it has to work a little harder, which means it gets exhausted quicker. Yeah, so it's not a thing to worry about. Again, that sort of discomfort you felt was coming from that same eye. So it leads me to believe you just have tension and stress. Now, if you feel any headaches, any pressure in your sinuses, I am going to refer you to our EMT guy. He can take care of anything regarding that area for you. Otherwise, you are good to go. Your eyesight is really quite well, especially, given that you haven't come to the eye doctor in so long. It's good to see everything's going well. If you have any concerns, feel free to take my card on your way out. You can also pay up there with the receptionist. Okay, thank you so much for coming in. Have a great day.